The Lumecca Peak is a little unique in that it's got a high-tech space-age polymer, or ceramic, inside that flash lamp that resists temperatures up to 100 degrees. If you look at other IPLs, I've got a Cyton BBL and I've got an M22 from Luminous. They're pretty good, but my pulse duration can never get shorter than 10 milliseconds. With my Lumecca Peak, I can get down to 1.5 milliseconds because it can resist very high temperatures and never breaks down with that polymer. It also has a proprietary low-pressure xenon flash lamp, fewer collisions, so it doesn't reduce the energy of those photons. And let's go to both sides now, on the sides, PowerPoint. And you get a left shift of that spectrum. So the Lumecca Peak is kind of laser-like. Most of the photons are close to the cutoff filter. So you're seeing a 515 cutoff filter. Why? She's skin type 1, 2, or 3. Our energy settings are about 8, 9, 10, 11, or 12 joules. You do a four pulse test spot each time, and often you go 1 or 2 joules each visit because your chromophore, red and brown, is going down. Certain important questions asked each time. Have you been out in the sun? Have you got any new medications, photosensitizers? I always do a test spot every time, and we adjust based upon that test spot. So Lumecca Peak is unique in that it is one of the most powerful IPLs ever created. So you've got to be a bit cautious, but the quick reference guide the company provides is a good starting point. Now, there are other good IPLs out in the market. I mentioned a couple of them, but this is great for a number of reasons. You get a 515 and a 580. 515 I use on skin types 1, 2, 3. 580 on skin types 4 and 5, never on skits, never 6. I don't do photofacial on 6. 4s and 5s I always pre-treat for about 6 weeks with a bleaching agent and then begin the treatment. You got to pick the right setting, and if you look at the green light of 515, it loves hemoglobin for rosacea and telangiectasia and superficial capillaries, and it likes superficial brown, so it's good for color correction. Typically, you see pulses like Shelby's doing now, who's my PA, and she's overlapping 20% with each pulse, but 180 to 220 pulses for a good full-face treatment. There's certain spot treatment techniques you can do on a tongue depressor, and you can do second pass with lower energy or higher filter on resistant areas. And so 515 cutoff filter, and the Lumecca Peak has a low-pressure xenon flash lamp, fewer collisions. So most of the photons near the cutoff 515 have most of the energy. It's kind of laser-like IPL. My other IPLs, they work, but if you look at my BBL, it has to be 18 to 22 joules per centimeter squared, or the M22, higher energy, because the spectrum is spread out. And if you make a mistake, or underestimate, overestimate skin, you can get into complications fairly quickly. So left shifting, number 1, photons are laser-like. Item or technology proprietary technique number 2 is not just the low-pressure xenon, but the lining. That special polymer that you're going to see on the quantum, at the tip of the quantum, resists 100 degrees Celsius, or 200 some odd Fahrenheit, so it doesn't melt, and you can use it over and over again with very short pulse durations. And so typically these short pulse durations give a high peak power density. When it hits the skin, it slaps, kind of like a Pico Sure or a Pico Way. So it's kind of like an affordable version of a pulse dye meets a Pico, which is why the Lumecca Peak is so successful. What do I mean by successful? That with this affordable Pico versus compared to a pulse dye, look at the power density. I can get a Pico-like effect, a pulse dye-like effect, and a single treatment. Reds look way better, single treatment. Browns are almost gone, often with single treatment, dyschromia and lentigines. Where with average IPLs, with a much more spread out spectrum and much lower peak power density, I need 4 or 5 treatments to get what I can get in a single Lumecca treatment. And so we flash on the skin like we saw, and when we flash on the skin, the browns and the reds with a very strong IPL will look better after a single treatment. Now, you might have a 3-treatment protocol once a month for 3 months, but a lot of my patients who see me, I do 1 assertive Lumecca, 1 assertive Morpheus, toxin filler, and a quantum now, and maybe a suture suspension in 45 minutes, and boom. Skin looks clear, looks bright, it's lifted, it's fat reduced in the right areas, it's tight, and it's smooth. And that's what we're going to see tomorrow. That non-surgical Quantum Optimus Max combo facelift with toxin and filler at the same time. Heat first, toxin, filler, suture in that order. Now, you can spread it out over 3 sessions, but you're still going to get a good 80% reduction in browns and reds. And so after a single session or a series of 3, the browns and the reds should look far better. I tell patients 50% better after 3 sessions. So under promise, over deliver, manage expectations. Ma'am, 3 treatments, 50% better. But you're going to often get 80%. And then they come back and go, wow, that's way better than 50%. Always take a photo at the beginning. It's worth 1,000 words. And show them the photo at the end. Manage expectations. 50% better. It's like marriage. Manage expectations. Under promise, over deliver. Under promise, over, and that's worked for me 4 or 5 times. I know exactly what I'm talking about. So manage expectations, and I'm just kidding. 1 amazing wife for 30 years and 6 kids. So beautiful skin, can't be brown and it can't be red. It's got to be luminescent and bright. And that's what Lumecca does. It's a great name, Lumecca, luminescent skin. Brown and red discoloration, 1 session and 50% improvement in a single session. Now, you might do it once a month for 3 months and get 80%, but tell them 50. Take a good photo, and boom, color corrections. Here's a workshop patient. I'll show you a bunch of workshop patients throughout the day. We did the Quantum and the Submenum and the Morpheus, 1 assertive Lumecca. That is a tremendous improvement in a single session. The reds around her nose, the browns, the dyschromia, much improved. Workshop patient. Quantum on the jowl, Morpheus Advanced Settings Jowl and Submenum, Lumecca, Botox filler, and a suture suspension. It looks great. Don't forget there's lots of bad skin, unattractive skin off the face. Look at the décolleté, look at the neck, look at the back of the hand. Shelby, hold up the back of her hand and show the back of her hand for me. We are going to include that because it's old spots. Her skin's going to look amazing. Her face is going to look amazing, but people are going to look at her hands and go, oh, she's done something. Look at her hands. The hands and the décolleté are the bane of a plastic surgeon's existence because you got to include them. You can't have the face looking great and the hands look like Tales of the Crypt. You know, you want to include them in the same package. And so, Shelby, you're not going to do that right now because you have not taken photos, have you? You have? You took photos of her hand and her forearm? And you did both? Are you happy with those photos? But did you take good photos, and do they look awesome? Because once you treat them, you can never get that pre. So you get some better photos, and then later today, treat them, okay? Because that's going to be part of our before and after gallery. If you didn't take a photo, it didn't happen. Remember, use those photos on social, have patients post them, get permission, put them on your URL. Okay, so look at that décolleté. If you don't warn her, she's going to go right to her lawyer or a competitor, say, oh, Dr. Mulholland screwed up. You're going to get scarred. Stick with me, you're going to be fine. They see them 2 weeks later, look great. See, it came to me, thank God. That's a normal melanin effect, and they have to know that. Because right away, she's going to go, oh, my God, he did something bad. No, we did something right. Because look at your skin 14 days later. Wow. Single session. Now, this patient had breast augmentation. Breasts look great, but the skin was so horrible, no one's going to want to touch them anyway. So you got to make the skin look great. I can say that it's Ohio. It's no DEI now, right? We're not woke anymore. I couldn't say that in California. No way. I'd get canceled. Gavin Newsom would kick me out of the state. Okay, so beautiful skin. Look at that. Isn't that awesome? Beautiful skin is beautiful because you see it and it's compelling and it's luminescent and it's bright and it's even. It's not wrinkled and it's not hairy and it's not cellulite and not chubby. That's what we're shooting for. And that's Lumecca. Here's some other patients at workshop, single session Lumecca, décolleté. And don't forget to look. It's kind of creepy. I always have a nurse in the exam room with me every time. Can I see your chest? Because that's kind of creepy if I'm alone. But with the nurse, let me see your décolleté. Why? Because I want your chest and your hands to match your face. For the rest of your body, we can do that over time, but that's why they make candlelights and dimmers. But if you look at this chest, watch a single session. See that big vessel down there? That was treated with the vasculase, long pulse YAG. Wow. Nice improvement. Don't forget the hands, like this young lady's hands and her forearms. If her face looks like she's, let's say, late 60s, early 70s, and her face now looks like late 50s, 60s, but her hands look like 90, you screwed up. Include them in the package. Skin type 4 with a little bit of dyschromia and melasma risk, I put them on a bleaching agent, 12% hydroquinone, some ascorbic acid, some kojic acid for 6 weeks, and then I treat them with the 580, not the 515, and you can make that skin look glowy, but they are risky. If they have true melasma, and they're, let's say, Hispanic or Asian, true melasma, I send them to a dermatologist, and we use a Q-switch, Pico-Way, or Pico-Sure, a non-thermal photoacoustic effect. But for Asian skin, which has a lot of patients in Toronto, this is a workshop patient. We didn't treat her décolleté. Hopefully you have been and include those photos. But if you look at her face, we bleached it, and then we treated it. And her skin looks far more resonant. So browns, got to get the browns. Now the reds. Red discoloration, rosacea, 1 or 2 treatments, that could never be done before. In fact, you have to be cautious with Lumecca. The pulse duration is so short, you can get purpura. So you've got to be cautious of purpura because patients hate bruising. It's hard to cover up. But you can make rosacea look far better in 1 or 2 treatments. Here's a workshop patient with a lot of reds, a lot of browns. We did assertive Lumecca. We did Morpheus for contouring, quantum submentum, toxin filler, and suture suspension. Single session. She needs to have a makeup session for her mascara, for sure. But look at the reds. Look at the browns, single session improvement. Rhinoplasty patient. Nose look better after a reduction rhinoplasty, but assertive Lumecca, 515 cutoff filter with the peak, and her skin looks awesome.